So once you begin to study herbs seriously, another question arises. Which tradition do I follow? Chinese herbal medicine contains multiple lineages, different traditions, lots of different traditions. I think the mistake is not choosing the wrong tradition. I think the mistake is being rigid, basically. Over the course of my own training, I studied deeply many traditions. I had my original training in acupuncture school, and that was somewhat unique because it was a five-element school and it integrated a deep understanding of five-phase cosmology into herbal practice. And I had, at that time, a somewhat shamanic kind of training or shamanic vision of herbs. What I mean by that is in the sense that I was learning to see herbs not as functions, but as beings, as living beings. What is this herb for? Well, what are you for? What is a tree for? What is a rose for? Nothing. It's a being. It is what it is. So that sense of looking at herbs, looking at plants, looking at things as living beings that were not reducible to their function. That's really what I mean. That was deeply part of my original training. Then I started studying with Jeffrey very deeply and had a kind of really intensive training with him where I received comprehensive instruction in herbal medicine, classical herbal medicine, channel systems, channel theory, channel systems theory, and many different specialty disciplines. I studied with him gynecology, pediatrics, oncology, ophthalmology, many different traditions. And Jeffrey at that time was giving a really clear transmission of what he had learned from his herbal teacher, Sifu Gong, what he called an Imperial Academy lineage or Imperial Academy approach. And that profoundly shaped my own clinical practice. Um, from this training, I really developed a very clear, methodical way of thinking and reasoning. Formulas were not merely prescriptions. Formulas were expressions of physiology and intention of E. Formulas conveyed the E and the spirit and sort of strategy for the treatment. So from my previous training, my previous overtraining, herbs were beings. And from my training with Jeffrey, formulas became teachers. Formulas were teachers. They taught us physiology, they taught us pathophysiology, and formulas teach us the intention, the E of their author. Formulas basically teach us Chinese medicine. So that was a very deep learning for me, and that's really where my own teaching emerged. And then the other part of that is that the practice of herbalism that I was learning from Jeffrey was really about building formulas from scratch for a unique patient in a unique moment in their life. Not looking for the right formula, but constructing the formula from that unique composition that is happening in the moment with the patient. And in order to do that, pulse diagnosis is central. So that's how I was trained, where pulse diagnosis and then for me also tongue diagnosis becomes very important. Pulse and tongue diagnosis allow us in the moment not to select the right formula, but to create the right formula. The other thing is the channel systems lens, applying herbs to the low, applying herbs to the center channel, divergent channels, eight extraordinary vessels. That I think is a very unique landscape of herbal study and practice, which is, well, very unique. It's not really found anywhere else that I'm aware of. And so really, looking at the channel systems and applying herbal medicine to those channels is something that I also really learned from Jeffrey and use, in my own practice and teaching. Each tradition is a lens, right? Each tradition is a lens through which we can see the patient, through which we can see the world, and each lens reveals something different. So the Shanhan Lun, the Jingfang Way sort of teaches us kind of structural precision and, matching a constellation of signs and symptoms to a formula that already embodies a strategy. When Bing, it teaches us about progression, right? About how heat and fluids are affected in layers over time or, very quickly. Uh, then there's this other lens, I guess this, you might say, like constructive lens, where we're building a formula from scratch and we have to train ourselves to respond to a unique patient in a unique moment, guided almost exclusively by the pulse and by the tongue. Then there's a channel system lens where we're really applying herbs and looking at how the low vessels, divergent channel theory, eight extra vessel theory, and using herbs to understand and apply that theory. And so on and so forth. So we have, lots of different perspectives. Substance lens, where chi and blood and fluids are giving us a kind of systemic physiological view of the patient. None of these lenses are mutually exclusive. And I think as we mature as herbalists, clinical maturity is knowing which lens we're using, and then how to shift, how and when to shift. So sometimes a classical formula fits precisely, sometimes it requires modification, sometimes we have to construct the prescription entirely from scratch. Flexibility doesn't mean that we're loosely improvising. It means a kind of disciplined adaptability. I think for me, the goal is not eclecticism on its own. No, it's not eclecticism for its own sake. I think the goal is to be able to shift lenses without losing coherence, to modify a formula when appropriate, to construct it when necessary, and to remain very flexible, especially in complex cases. So for me, herbal medicine is in an allegiance to a particular school. It's a disciplined flexibility, it's a disciplined adaptability grounded in clinical understanding to be able to move between lenses without losing clarity. That's my goal, and that's what I'm training people to do.